I'm going to speak about e-mental health and virtual solution in low and middle income countries, and I'm going to focus on Africa and Egypt as our experience. I am Mostafa Kamel. I'm a consultant psychiatrist and lecturer of psychiatry at the Faculty of Medicine, Tanta University, Egypt. I am the WHO consultant for mental health in Egypt office, and I still have my affiliation with addiction and concurrent disorders as I was a PhD student with Professor Krause for youth mental health and digital solutions. Today, I'm going to speak about the mental health care system in low and middle income countries and what should we have a paradigm shift towards e-mental health and Egypt as a role model. Nearly half of the world population, about 3.4 billion, live in low and middle income countries. They are hosting about 90% of the world children and youth. Regarding mental health burden, almost around 3/4 of mental illness burden lies also in low and middle income countries, with about 75%, more than 75% of global suicide death happens in low and middle income countries. What challenge do we have regarding our mental health in low and middle income countries? First of all, we have limited resources and expertise, as I'm going to show in our Egyptian experience. Lack of awareness in some African and other low and middle income countries. Mental illness is still as a taboo topic in some cultures. The situation is not here in Egypt, South Africa, Morocco, other more educated countries, but still in some low and middle income countries have the same problem with it. Stigma play a significant role in this. Scarcity of research. A continent like Africa is about 2% of the research regarding mental health all over the world, so it's very scarce. The mental health expenditure here, as I will show, is very low. In some African countries, women have a lot of burden and stressors, such as occupational stress as household beside her current job. In some cultures, they are exposed to intimate partner violence, and they have a lot of barriers to seek help. Stigma is on the top of them. So do we have gap in our system? Yes, around 85% of people suffering from mental illness in low and middle income countries receive no treatment. Even worse, the gap between the first warning sign, mental illness, and access to effective treatment can reach up to 15 years. 1% of our total health expenditure estimate is to mental health. Only 1%. And much of these funds are devoted to building new psychiatric hospitals. Here we can see about mental health expenditure in USA dollars in different regions in the world. Here in Europe or America, it's about 11.8. In Europe, about 22 almost. In Africa, it's about 0.1 US dollars per capita spent on mental health. And in the other table, you can see that about 40% of them is out of pocket. So with this current situation, I think we still have a brighter future. When we first met Professor Krause at 2018, we started analyzing the situation. We see about the current situation in Egypt and other African countries. He spoke to me about we don't have a lot of solution other than e-mental health and virtual solutions. I remembered he told me the story about Raj Punjabi. He asked me to show the TED talk of Raj Punjabi, who said that no one should die because they live too far from a doctor. With his experience in West Africa during malaria pandemic, yes, this concept, we start thinking about it. No one should suffer because he's too far from a psychiatrist in our countries. That's from where we start. Directing to Egyptian situation, Egypt is the most populous country in the Middle East with about 100 million population. 50% of 25 years old, 2.5 million are in the higher education system. Regarding the burden of mental illness, we can see here that about 45% of the burden of illness in this age spectrum before 25 years old comes from mental illness, and about 75% of mental illness starts before the age of 25. The analysis of the current situation in Egypt, we have around 0.7 psychiatrists for every 100,000 population and 0.2 psychologists for every 100,000 population. Not only this, but we have disproportionate distribution among urban and rural areas. Most psychiatrists are concentrated in Cairo and Alexandria as big cities. The situation is catastrophic for child and youth, with about only 3% of these scarce resources, only 3% are working with the youth. With that, we have about 20 to 30% of Egyptian adolescents are diagnosed with mental illness, depression and anxiety are the most common. This figure increased to about 37% in university students and about 65%, especially among medical school students. Stigma is deeply ingrained in the family and socio-cultural fabric of the Arabic society. Now it's much better among the younger generation, but still in older generation, stigma against mental illness, especially for women. This is magnified if they have mental illness or addiction. That appears clearly in the official number of suicide. We have maybe daily in the news we can read about suicide, but the number sent to the WHO at the end is about 35 or 36 because of the stigma of suicide, and the families wrote it as a heart attack or some sort like this. Our teens in our society are under stress, unemployment, for the quality of education, family, financial stressors. So all of these make burden on the adolescent here. Regarding substance use, about 22% among students are using substance. Cannabis on the top, tramadol here is a great problem also among university and students and youth. The age spectrum who had the highest rate of onset of substance use is between 15 to 19 years old. So, depend on Egypt as a role model for other countries. We started analysis situation regarding our mental health needs for the students. We started thinking about the concept of e-mental health, start connecting with psychiatrists and with youth representatives. We determined our priorities for Egypt, start from strategic framework for the e-mental health, dreaming of national, having virtual programs, and national e-mental health plan. According to the funds and interest here, we started by two main big projects, the e-mental health platform and the first virtual mental health application for university students. We had a lot of challenges regarding our e-mental health implementation, the resistance which came from the staff here, from psychiatrists and care providers, the confidentiality of the data, the funding, and the ethics. We dealt with everyone alone regarding the resistance, which came mainly from the psychiatrists and the care providers. But thanks to the COVID situation and what have happened and people started working from home, this much changed the concept and the idea of this resistance and allowed us to hold our first conference, which was virtually about maybe the first mental health, when was the first one in the Middle East, held by the Tanta University with Professor Krause and Professor Ian Hickey. For confidentiality, we started asking about psychiatrists about how what will be the barriers for using e-mental health in Egypt. It was published in JMIR journal. Most of them was concerning about privacy and confidentiality. So we used the servers of Ministry of Health and are very safe regarding this. For funding, we applied for a proposal with the WHO. It was my first contact with the WHO here in Egypt and the Ministry of Health. All of this allowed us to score our first goal regarding e-mental health strategy in Egypt, and we had our first Egyptian e-mental health plan. This supply or provide people here with information and resources about mental health disorders and have a lot of self-assessment tools. We are going to build new capacities such as CPT. We are going to integrating this with the current system and school and academic. We launched it in March 2022, sorry. So over the year, we have around 80,000 visitors. 70% of them were females. Regarding the marital status, about 81% of them were single and 64% of them were unemployed. The majority of them, as we were asking about in this age spectrum, we were targeting under 25 years old, represent the majority of visitors. The users of the platform mainly came from the also big cities who are more tech savvy, which is expected, but also we have from different countries. From all of these 70,000 visitors, we had held about 4,000 virtual clinic visits. So we have seen about 4,000 sessions by psychiatrists and our therapists. I have a lot of screenshots from them, but it's in Arabic, about people who are in cities who are about 1,000 kilometers from Cairo, who had been helped by this platform, and they were in suicide, and the help of the therapist and psychologist here prevented them from committing suicide. So I think there are a lot have been done over the last year. Most of people visit for general psychiatry, then for child and adolescent psychiatry, geriatric psychiatry also, and for addiction. Mainly for addiction, people were asking about how to treat addiction disease. So this was about the e-mental health platform for the first year. Now we are working on another project, it's mental health application for students. This will be unique because it will be the first time to make application from students to students and by students. So we are depending on middle school students and IT school students to design the application and put the content, how to adapt the content, make it more user-friendly to them. I'm just supervising what they are doing, but will be something unique because it's mainly from students. We are not targeting mental health also, but we are trying to be for the whole students and for all students. We are making it like for lifestyle monitoring, for target prevention of mental illness, have life chart, peer communication, art window, and how to engage family and peers. So it will be connected in every university with the psychiatry department, hospital, and if for triage and for any further assessment need to be done by psychiatrists, will be how we will have like this referral system for the existing system, and could be a nucleus for research for mental health, which we have a problem here in Egypt because we don't have this kind of data. This is a team of students who are working now on the student mental health application, and we are planning to launch it this summer. The next 3 slides I used from the students' presentation in our project. So this is from students. The topics will be covered. They determined these topics to be covered for their application for self-care, mindfulness, the body image, what they do when they have out of mood, relationships, sleep. So they have all of these topics for them. This is also created also by the students here. How can we, for the self-care, what are they going to include in the application? We are going to use what's going on now from existing resources all over the world, and they are going to adapt it and create their own with the help of our IT department. We are going to link it with the first virtual clinic with Tanta University. We are going to use our university as a pilot study for this. Will help students to have better access for services and with higher quality because it could be only done with staff members of psychiatry department in Tanta University. Another 2 big projects are going on now with the WHO and the Ministry of Youth and Sports here in Egypt. We are going to integrate make like a mental health spot or well-being spot would be like building access point for students and youth in who are with a challenge, and the university and youth recreational center would be like a room well prepared and well connected with the platform to help youth and students regarding their mental health and physical health. We are going to pursue what's happening on Australia, like Space Australia, to integrate physical and mental health in one place. Mainly, we are going to depend on recreational center in Egypt. We have in Egypt over 5,000 recreational centers. So we are going to sign a contract, a collaboration between the WHO office and the Ministry of Sports and Youth here to make this integration. I think it would be very beneficial for students. These pictures from Headspace, and we are going to pursue it and adapt it to the Egyptian culture. All of these projects are going under international partnership with University of British Columbia, with Professor Krause. We are going to pursue data from risk assessment and management platform and walk along as our role model to adapt it also to our culture. This is our international network who are actually supporting us and supplying us with materials. Professor Jan Hickey, Professor Krause, Daniel Vigo, Kerry Yang, all of them are really supportive to us. So according to Professor Krause's slide, yes, this is what we are aspiring to make this integration between the virtual clinic and face-to-face services, and with the web platform, all of them will be in integration system. Actually, we have started our steps now regarding the e-mental health platform. We are working now in the virtual clinic, and we are going to merge all of them in a national telehealth center in the future. In conclusion, in countries like Egypt, we are thinking about like mental health and substance use are considered as a priority. Innovation is essential to overcome the current deficiency in the system. National platform is our excellent start. We are pursuing this achievement and success in other projects. We have a dream. We started in Egypt, and we have a dream to expand to all Mama Africa. Thank you very much.